Although many of your EMS calls will involve the circulatory system, respiratory system, and trauma, a portion of them will involve the renal system or kidneys and hematologic system or blood. There are many hematologic and renal disorders in which a patient will require your assistance. While your treatments for these conditions may be limited, it is important to perform a full assessment with a patient history, as many of these patients may have additional medical complications. Hematological system. Blood is one of the body's many organ systems. It is composed of blood cells and liquid plasma, which provide oxygen and nutrients throughout the body. Blood plasma contains blood cells, glucose, proteins, mineral ions, and hormones. The main component of blood is red blood cells, or RBCs. These cells contain specialized molecules called hemoglobin, which bind and then deliver the oxygen to various parts of the body. White blood cells, or WBCs, play an important role in the body's immune system response by fighting infections. Platelets, or thrombocytes, are fragments of blood cells which are primarily responsible for early stages of clotting. While the clotting process is beneficial in slowing bleeding when injury occurs, it can be destructive when it occurs within the circulatory system in locations such as the coronary arteries. A blood clot formed within one of the coronary arteries can block oxygen-rich blood from reaching heart muscle. This leads to a myocardial infarction, also known as a heart attack. Anemia. When a patient lacks red blood cells, they become anemic. This can be caused by trauma, gastrointestinal bleeding, heavy menstruation, or disease. Sickle cell anemia is a genetic condition which is most common in patients of African descent. Healthy red blood cells are round and pliable. A patient affected with sickle cell anemia has RBCs that are not as flexible, and they are shaped like a sickle or a C shape. The abnormal shape of the cells and lack of pliability cause them to build up in the capillaries, resulting in severe pain in the arms, legs, abdomen, and chest. The lifespan of sickle cells is not as long as healthy red blood cells, and this results in anemia. Buildup of these cells is a systemic problem. In the spleen and liver, they cause tissue damage. In the chest, blood vessels can become blocked, causing hypoxia. And if the blood supply to the brain becomes compromised, a stroke can occur. Patients with sickle cell disease have abnormally short lifespans. Treatment of anemic patients. Treat anemic patients with high-flow oxygen via a non-rebreather mask. Perform a primary assessment while paying special attention to respirations and ventilate if necessary. Continue to monitor the patient and transport in a position of comfort. The renal system. The renal system is responsible for the filtration of blood. The kidneys filter waste products from the blood and regulate the fluid levels in the body. The system is composed of the bladder, 2 kidneys, 2 ureters connecting each kidney to the bladder, and a single urethra to excrete urine from the bladder. Renal failure. Although kidney stones and urinary tract infections are very common, they are often not life-threatening. Renal failure, however, can be life-threatening if left untreated. There are many causes for kidney failure that include kidney disease, ingestion of toxic substances, hypertension, diabetes, and dehydration. Some, such as dehydration, may be easily treatable, while others may progress to a state of irreversible damage known as end-stage renal disease. Fortunately, kidneys are among the most transplanted organs. A patient with a kidney transplant leads an ordinary life with one exception. They must take immunosuppressant medication to prevent the body from rejecting the organ. Patients who cannot receive a transplant must undergo dialysis to filter their blood. There are two types of dialysis: hemodialysis and peritoneal dialysis. Hemodialysis. The hemodialysis process involves removing blood from the body, running it through filters, and then returning it to the body in one continuous process lasting a few hours. Because such a large amount of blood is circulated through the pumps, and some patients require multiple treatments a week, specialized ports called a fistula are surgically created to gain better access and for more efficient treatment. Fistulas can be seen as a protrusion under the skin and should be avoided when possible. When taking the patient's blood pressure, be sure to use the opposite side. Peritoneal. This is a form of dialysis that often takes place in the patient's home. This is a slower procedure and requires multiple treatments a day. This treatment requires a catheter to be permanently inserted into the peritoneal cavity through the abdominal wall. A specially formulated solution is inserted into the peritoneal cavity where it sits for hours, absorbing toxins. It is then drained into a bag and discarded. Patient care. Patients on dialysis have the potential for infection, clotting, and bleeding from the AV fistula site. Perform a primary assessment and control major bleeding. If bleeding cannot be controlled, avoid the use of a tourniquet and call for medical direction. Administer oxygen via a non-rebreather mask. Check the patient's temperature for a fever, indicating an infection. Monitor the patient's vitals and treat for shock if necessary. Transport to the closest appropriate facility. Patients in end-stage renal disease who miss their dialysis treatment can be in serious condition. Because excess fluid has not been removed, patients' symptoms will often present the same as in patients with congestive heart failure. The symptoms may include difficulty breathing, accumulation of fluid in the lungs, ankles, and hands. Also, because of the buildup of potassium and other electrolytes, cardiac dysrhythmias may occur. Perform a primary assessment along with taking vital signs. Administer oxygen via a non-rebreather mask. Be prepared to place the AED on the patient as cardiac arrest may occur, and consider calling for ALS support. Transport the patient immediately.